Are you suffering from a herniated cervical disc and you don't know what to do about it? If this is the case, then this video is for you. Today I will be sharing my secrets on how to treat a herniated cervical disc. So keep watching. I have seen many patients with this exact problem over the last many years as a corrective care chiropractor. My name is Dr. Kristina Turkewitsch and I'm a chiropractor in Newmarket, Ontario, Canada. And you can check out my other videos where I share my knowledge from my clinical experience, as well as lots of tricks and tips that I've learned over the years that can really help you with, any of the problems that you've been experiencing. Now, the truth is that a herniated cervical disc is a significant problem and it should not be taken lightly. And the reason for this is because there's usually it's very common that there's a lot of radicular symptoms that go along with this. And it's because of the nerve root compression. And you can also have symptoms because of any kind of spinal cord compression as well. So it's important to take the steps to start to heal a herniated cervical disc as soon as possible. So let's get into it. I'm going to teach you my secrets on how to treat a herniated disc in the neck. So first of all, what you're going to need in order to heal a herniated cervical disc is rest, right? You're going to need a lot of rest. If the herniation is somewhat mild, the best case scenario is that it will heal naturally, right, in 6 to 8 weeks. However, a lot of the time that's not the case. And so you really have to put in a lot of rest, and you're going to have to modify, things that you're doing in order to help facilitate the healing. So right at the beginning, especially, you're going to feel a lot of pain. You can feel a lot of pain in the neck. And if it's severe enough, you might have symptoms radiating, down through the arm and into the hand. So you're going to want to take it easy and modify things so that you can give your body the absolute best chance at healing this. So my recommendations are to, refrain from strenuous activities and, anything that requires a lot of physical labor or any kind of playing of sports, right? So you just really want to take out any of that strenuous activity. Next, you're going to want to avoid specific movements that worsen the pain, okay? So such as maybe turning your head to one side or lifting your arms above your head or anything that you find makes it worse. So you're just really going to want to avoid those movements as much as you can. Modifying your sleeping positions would be another significant thing you want to make sure you're doing, because, when you're sleeping, how you're sleeping is really going to affect how much pressure is being put. So you might need to change your pillow, you might need to change your sleeping position so that you're sleeping more on your back. And when you're sleeping on your back, you want to make sure that, your neck is supported well. You also have a pillow under your knees, okay, to take off any spinal cord tension or any issues that can happen where, you're jamming the joints of the neck or the low back. So you're going to want to change probably your pillow, or you might have to change your pillow so that you have a better supportive pillow. You also might have to change your sleeping position. If you're used to sleeping on your side, you're going to probably want to avoid that for a time. You might be more comfortable on your back. So just kind of move around and see where the most comfortable position is for you to sleep. That takes, the pressure off. Usually it's sleeping on your back. However, that might change person to person. So the pain and discomfort can be quite debilitating, right, depending on the grade of the herniation. And so rest and activity modification will really help the herniated cervical disc become less painful. Ultimately, with the herniated cervical disc, chiropractic care is really one of the best options here, right? It's really one of the best options out there. And you're gonna really need to start seeing someone right off the bat, as soon as you can. As a corrective care chiropractor, I help get, stability back, help get the function back, and I help to start to improve the posture of the neck, so that can really help to take the pressure off. And by taking the pressure off, we can start to reduce the pain and start to reduce those radicular symptoms that are traveling, down into the arm, down into the back, or even up into the head. So chiropractic will get to the source of the problem and accelerate the healing process. So lastly, I wanted to share with you some exercises that I think are really going to help you, and they'll help basically take the pressure off a little bit so you can start feeling, a little bit better until you're able to find a chiropractor who can really help you with this. So I have a few exercises for you today that will be including traction. And traction is really what's going to help take that pressure off and kind of decompress the area so that you can get some pain relief. So with traction, you're going to create basically a bit of a pulling sensation in the neck so that it can really just distract that area and decompress that area in the neck that might be getting compressed because of the herniation. So in order to get some neck traction at home, we're going to use a towel. So you can just grab a hand towel or a hair towel, and you're going to roll it up, okay? Firstly, we're going to create some traction by pulling forward on the towel, okay? So you're gonna start to feel some pressure at the back of your neck. And now, in order to start getting the traction, we're going to extend the head back. So you're looking up at the ceiling a little bit, okay? And you're pulling through. Now, if at any point this becomes painful, it shouldn't be painful. So if it becomes painful, if symptoms start to worsen, you're going to stop, okay? But yes, so we're just going to pull and then extend our head back. Next, we're going to bring the arms up like so, and you're going to be pulling a little bit on the towel, okay? And so you should start to feel pain can ease up probably within about 30 seconds even of doing this, okay? And so if, again, pain does not go away, it starts to worsen, please stop. But if it's working for you, you can continue and hold. So hold that position for about 15, to 30 seconds and then ease off and then do it again. So you can do it, about 3 to 5 times. What you might notice as you do this is that pain will start to centralize, okay? So issues, pain, anything that you've been having going down the arm, you'll notice, or you could notice, it start to just travel back. Pain will subside in your arm and it would just kind of become a little bit more around the neck. So that's what you call centralization of symptoms. And what that means is that we're actually taking pressure off of that nerve. So the information going through that nerve will start to improve, and so the symptoms can go away, as well as relieving the tension, maybe taking off some of that inflammation in the nerve. So if you start to notice that those traveling pains and symptoms start to lessen, then this is obviously working for you. So continue to do it. For this next exercise, we're going to be doing something similar, but we're going to be focusing more on one side, okay? So the first thing you want to do is crisscross your arms, okay, with the towel. And you're going to, again, be pulling. Actually, I'm going to go the other side. You're going to again, be pulling forward slightly, but then you're going to, and I'll try and get this on film, you're going to bring one side up and one side down, okay? And so, you'll kind of be angling more towards one side, right? And as you hold it, you should notice that it'll start to really relax on that side where you're having the primary issue. And so you're going to want to hold it again for about 15 to 30 seconds, and then you can back off. And do it again 3 to 5 times. So once you start doing these, you can do these every single day. You can do them a couple times a day. And as you start to get that centralization of symptoms regressing kind of back just to where it started in the neck, I really think this is going to be valuable for you until you're able to visit a chiropractor and really get to the source of the problem. But this, will help you in the meantime. So thank you so much. I really hope you found this valuable. If you have any questions for me, please drop those below. Let me know your experiences as well with your disc herniations and how, what has helped for you, what hasn't worked for you, and let me know if these exercises are something that you've tried and if they've worked for you. Thank you so much, and I'm just going to put up another playlist here. It goes into some more detail about herniated cervical discs. I hope you can enjoy those, so go check those out next and give you some more information.